All right, everybody, welcome back to another edition of the Bulletproof Dental Practice Podcast. Today, Craig and I are excited to have on David Eshom from the other coast, the left coast, because we're on the right.
Hello. Yeah.
Okay. David's been a dentist since 1988, right?
85 graduated.
85 graduated, been in San Diego.
Yeah.
San Diego
Back in the
since 88. And very successful practice would be an understatement. A very successful career would be an understatement. He's had 100% fee-for-service practice since 1992. He's doing 3.2 million in production and collections, and has an Invisalign practice that is north of 400 cases a year. So looks like Invisalign. We have two Invisalign superstars on the call today. One being the illustrious host, Craig Spodak, and the other being our new guest, David. So, David, let's jump into. I got a list of some things we want to go through, and I really want to see. Yeah, I want to hear your story, unpack that, and just I want you to contribute to our listeners and kind of show your journey and where we can better ourselves and our careers. Welcome to the show.
Great. No, thank you very much. I appreciate representing the West Coast, and again, to you and Craig, I compliment you on your show and what you bring to dentistry and to dentists that want to do the work and take advantage of the information. And so I've done that with you guys for a while and been listening. So I appreciate that. But,
how many times have we offended you, David? Just curiosity. Just any times we've offended you on the podcast?
No, you kind of never offended me, just
really?
tested
Okay.
me. There's quite a few F-bombs that get thrown around. But
That's Craig.
Me being from the 1900s, it's just a little different, but that's what I hear from my kids. So
Dave, you are very relevant right now. You're coming from the West Coast, and you're Dr. Dre. Your DRE. For those that are watching right now, Dr. Eshom is coming off as DRE. So Peter Boulden is listed, and we got Dr. Dre. It's the East Coast West Coast thing.
I guess, yeah. I've heard that name, but I couldn't tell you one of his songs.
Well, your initials. Obviously, you have an R for a middle name, right? All right.
Dr.E.
I told you before we recorded, I would have doubled down on that, and I think I would just become Dr. Dre. Since
Tell the real Dr. Dre to please sit down.
Yeah, sit down, please. So let's talk about some stuff. I mean, let's unpack your journey a little bit, David, about kind of how you started out, why you decided to go fee for service, and then just how it's evolved and what you're seeing now and in the future.
Yeah, I mean, much like you guys, when I first got out of school, I took as much CE as I could. And fortunately, the people I bumped into were people like, for me, it was like Jim Pride, and then it was the AACD, and then losing some names here, but they were all talking about doing quality high-end dentistry and how insurance companies were holding dentists down from being able to practice that way. And so along with studying that and implementing that, we started in '88 and then did some consulting and then got rid of the Blue Crosses and the Blue Shields, and then eventually Delta, and since 1992 I've been done with Delta. I feel really that the insurance companies are really cranking up the pressure on dentists now by limiting what they pay for and how much they pay for. And there's the parting of the sea in terms of, there's going to be the higher end dentists, and then there's going to be people that are doing it on price. So I'm on the higher end side, and I'd like to promote to the younger people out there that that's still a possibility.
Yeah, you hear that. I mean, I think the messaging now is fee-for-service can't work. I've had several young dentists come with me and be like, well, your practice is kind of like a unicorn. And I say, not really. Like, if I can do it, what's to say that you can? And obviously, David, you have a fee-for-service practice in probably a very competitive area.
It is. San Diego's very competitive.
Saturated. Like, who doesn't want to live there? Everybody.
Yeah, and the practice is growing, and bringing on an associate and trying to teach her how I practice so that she can carry on that same tradition, because we don't have to be herded like cows from the insurance companies, and then they're just milking us for our knowledge, and we're having to pay the dental school bills.
Yeah, and they're if you haven't heard, they're hefty bills these days.
I definitely have heard.
Hefty.
So
Yeah.
So yeah, so that's what I've done. And then, the first part of my journey was in cosmetic dentistry, and developed a boutique all fee for service practice in cosmetic dentistry. Got my accreditation from AACD, was involved with AACD, and then things were rolling along pretty well until 2008, and the recession hit, and I finally saw a recession affect my practice. The previous recessions hadn't. And so things in terms of my production were going down. And so, as usual, being forced to do something and think outside the box, that's when Invisalign came into my practice in a kind of a untoward way. I was through an associate. I had an associate, and she was doing Invisalign. And at the time, I did feel like it worked. So, I was going, how can you put plastic on the tops of people's teeth? How are you going to fix occlusion? How are you going to finish the case? And so I never thought it worked. So at 2008, I had to lay off some people and lay off the associate, and I inherited her cases. And so I finished the cases, learned a little bit about Invisalign along the way, and found out that it worked, and then became in love with it because it's the most minimally invasive way to improve somebody's health and smile, and without grinding on any teeth. Mm-hmm. So it became a love. And it became a necessity, really, in order to diversify my practice and rebuild it from, the losses it had in 2009 and 2010. And so I've been learning to do that and building that way.
So what portion of your practice would you say Invisalign encompasses now?
It's probably a third of my practice.
A third, okay.
And it's pretty much all delegated.
Yeah, you said
it's pretty much all delegated.
It's all delegated, okay.
But a third of your revenue, or am I still really loud, guys?
No, you're good.
Okay,
you're good.
Because
you're not loud at all, actually.
It's about a third of my revenue. A third is Invisalign, a third is cosmetic dentistry, and a third is general dentistry.
And what do you mind if I ask you, do you have a tiered charge system or a payment system or a cost for Invisalign, or is it everybody's the same exact fee?
No, we have different levels of difficulty that we go through, Craig, and it goes anywhere. When you fill, with all-inclusive fee, goes anywhere from $4,000 to $5,800 on the real difficult cases. The longer the cases that we anticipate to be longer, and each patient comes in and we evaluate them. Most of them go in that level 2 range, and it runs somewhere around $4,500.
Got it.
Do you guys find? I've had a question to ask to Invisalign guys. Do you guys find that it's been somewhat commoditized, and there's a lot of tire kickers, people just looking for the cheapest Invisalign price? And if you're not that guy, because they know that, because in the era of like Smile Club Direct and all this stuff, they know that quote unquote Invisalign's doing the work, so I'll just find the cheapest person. Are you seeing that?
Actually, I want to speak to that because even though the public perception may be that Invisalign is a commodity, it's actually, I've started over and taken over, I'm sure Dr. Eshom has as well, a lot of cases that were, completed by another person and they're not really done. So just like cosmetic dentistry needs to be designed, I don't ever get a ClinCheck back, or I shouldn't say ever, but it's very rare that the first go around I accept it. There's always some tweaking. So Invisalign is a lab, and without the prescription and without the design factor, you're not going to get the most exceptional results. So I tell patients that all the time, but I'm curious to hear, Dr. Eshom, what are your thoughts on that?
Dave. My thoughts are I agree with the public perception that that's the case, and we use that to our advantage in terms of developing patients. And so when I went to start doing more Invisalign, it was really hard for me to put an Invisalign page because my strategy with Invisalign was going to be lower cost alternative to an orthodontist. And we were going to give high service and also a great smile. So that's kind of our strategy. But I couldn't really put something low cost discounting on my boutique website. And so at the time, Apple had come out with these iMovie and iWeb. And so I put together an iWeb website just for Invisalign. And it's called San Diego-Invisalign. And so there I was promoting low cost, but high service and great results. And because
what year
of that,
was this, David? What year?
This is 2009, 2010. And so at the time, so I had a website geared just for Invisalign. And
So you were doing a bunch of a micro site essentially just for
it was
that.
a separate site, a whole separate domain.
That's why I was asking the year, because I was hot and heavy in all that as well, kind of niching out and doing not some not a squeeze page, but essentially to that effect. It was a one page.
Well, landing page, right?
And that has evolved to the landing page now.
Yeah.
And so that was kind of my angle, and it worked pretty well. And then, so I was getting, 2 or 3, 4 consults a week from that. And then I wanted to do more. And so I went to the local bookstore and went right to my favorite section, which is Everything for Dummies. And I pulled the AdWords for Dummies book out. And I read that and I go, hey, wow, I could do pay-per-click and I can advertise, low cost Invisalign. And the people that you're saying, Peter, that were looking for it and looking for kind of a commodity would find me. And so we did it that way. And then it went from there to spending $1,000 and then spending $2,000. And now we spend over $5,000 a month on pay-per-click, but we're doing 32 or 33 cases a month. And so that's
just AdWords, Facebook ads. Where's your breakdown?
Pretty much, well, I mean, my website, is number 1 in the area. But we probably get 60% of our cases from pay-per-click.
Okay.
60% from advertising. Wow. I'd imagine with that many happy Invisalign patients, you'd be getting a ton of, well, I guess it's just the numbers you're doing. So you're doing 30 cases a month. Yeah. So you're getting internal referrals. You're getting probably what?
15 to 20.
Yeah. It's a lot. That's awesome.
Yeah, 15. And so it's evolved to the point now that I had to build out a whole separate office space for it. I couldn't connect it to the office I have now. It had to be upstairs. And so in October, we opened a new office up there that is pretty much all Invisalign and a hygienist.
What's your office?
Awesome.
Give us a virtual or a tour essentially, but not virtual, but just walk us through how many chairs what's your operation look like?
Before October, I had 4 chairs and one day of hygiene. And I was having 2 chairs of Invisalign. And it was just squeezing me in my one operatory. I could never run late. I could never take on an emergency patient. So then October, we opened up upstairs, 4 ops, 1 hygienist. And so we have the same office downstairs, 4 ops, 1 hygienist now.
Wow.
So up until that point, though, you were crushing it in a 4 operatory practice.
Yeah.
$3 million in a 4 operatory practice.
Correct.
Wow.
Yeah. And we were working till 7. We were working on Fridays. We were working on most Saturdays. So, I expanded my capacity in order to handle that.
I always love to kind of look at
you work 6 days a week most weeks?
No, about a year and a half ago, I brought on a half-time associate that just all they did was Invisalign consults. And then when we opened the office upstairs, it's a full-time dentist upstairs. All they do mostly is Invisalign consults. And then when there's time, they'll put on or take off attachments and that kind of thing.
I always run this game in my head whenever I see an operatory or I'm building an operatory, and I just kind of like envision its life as this room, right? And I'm like, and then I think about like annual, like what's its cap going to be this year? Like what could you possibly do? And so I've always been stuck around the 550 mark if you do the math and reverse it, but your math just turned out to be close to 800,000 for each room in an annual basis.
Yeah, in a corporate sense, in the corporate world looks for 250 per op. That's like their mantra.
Right. But it's just, that's neither here nor there, but obviously you pushed that way outside what I've ever heard. So that's pretty, it's just cool to kind of think about, hey, room that I just built and spent a lot of money on. What are you going to, like, what potentially could you do every year? If you were going to grow up and be a big room.
Yeah, no, I wish, I'm probably going to be wishing I had some more rooms, but right now I'm just trying to learn how to manage this. And, you guys manage things much bigger than I do, but just learn how to manage it, keep the quality of patient care up and patients happy and good reviews coming in.
How many employees?
We have 16 employees.
Wow, it's so lean for that many, that much treatment. That's awesome.
But it's not lean for that many ops, right? He's just super. You probably have what, 2 chair sides yourself, an Invisalign, like scanner.
There's 2 scanners. I have one down here, one upstairs. And there's, I have RDA, what we
But you
call
said it's delegated
extended
pretty
function.
heavily early in our conversation. So I was
Right.
assuming that you've got a lot of hands making work.
Yeah, I use in California, you use the EFs, the extended function assistants. They can
Okay.
put on buttons, they can take off buttons.
That's awesome.
Doctor does IPR. So to be honest with you, I don't do the consults now.
Wow.
And I don't, all I take are the trouble cases. So when something's not going right, I get to see them and figure out what's going wrong and get it fixed. And then if somebody absolutely wants to see me, they can come see me. And so, but I do all the clin checks like you do, Craig, because that's the most important thing. And Invisalign is not the same at one office versus another, all based on the diagnosis and the clin checks that are set up.
Yeah,
So
it's true.
So
And
that,
the thing is, your foundation with the American Academy of Cosmetic Dentistry and all that work that you did up to this point, and it was my training as well in cosmetic dentistry that allowed me, cosmetics and occlusion, to deliver the Invisalign results. Knowing how the teeth should be shaped and positioned for an aesthetic
Yeah, like
result.
what's
Doing it
ideal, right?
Facially guided too.
And that went back to
Exactly.
you setting dentures.
Yep, exactly. It's like Frank Spear. It starts with the incisor.
I didn't learn it when they taught me dentures, Peter.
Not that you learned it.
But
Not that
I
you
learned
learned
it from
it.
Frank Spear. And then now, if I had a set of denture, I was good. And whenever I do my consults, that's one of the things I talk about. I go, look, we don't just make your teeth straight, and we don't just make them fit together better. We make you have a nice smile. And that's really the difference about our office, is that we think about your smile first, then we think about making your teeth straight, and then we think about making them fit together.
So that's Spear's spatially generated treatment plan, correct?
Yep.
For me, it is. You might get it at Koish, you might get it at other places, but that's where it came from with me.
Okay. That's awesome.
So so that's been a big thing, and I want to let other doctors know that if you can do a certain amount of Invisalign, it can be a big help to your practice. It can make things a lot easier. You can even bring it to the point where you can be dropping those lower paying insurance plans, and really start enjoying doing dentistry a lot more, because you're seeing these people come in with gnarly smiles, wanting help. For me, they're in their 25, 26, 27. They kind of lost their stuff in terms of how they look and so forth. And then you can change their smile without having to grind on their teeth, or, as what my friends from the Academy of Cosmetic Dentistry would say, smoke some enamel. Let's go smoke some enamel, and you can just do it minimally invasively, and it's a real feel-good thing.
Hey, Pete, can you see what I just put up?
All I see is a hairline.
I see before and after. Very nice, Greg.
Okay, so what I'm showing is, we talk about arranging the smile in such a way, but we can actually change the face. I hope, Pete, you can't see that, huh?
Mm-mm.
Yeah, I was trying to put some content up here. Dave can see it, but
Yeah, I can see it before and after.
Yeah, so it's just a way to.
Was that a humble brag?
It was a humble brag, but it was just to show, because people think, I think that they misunderstand what Invisalign and orthodontics in general can really do. But when you have a constricted arch form, or someone, puts a permanent retainer on the lower 6 sexy teeth, or the upper 6 sexy teeth, and lets them collapse over the next 10 years, you get a different facial, profile than a properly expanded arch form that looks better. It's, it's like the first thing you learn in cosmetic dentistry is that you never do the front 6. You do 8 or 10. Yeah. And I think there's a lot of poorly trained orthodontists out there that are just worried about how the front 4 incisors or 6 anterior teeth look. And we see that because there's a lot of people placing fixed retainers and not worrying about the posterior expansion they occurred. And I've had, I would never go to say this to a patient up front, but I've had tens, if not 50 people tell me they stopped snoring. I would never make that promise to somebody. I would never look someone in the eye and say, oh, well, do you have Invisalign, you'll stop snoring. But anecdotally, I've had people like, oh, by the way, my snoring got better.
Yeah, well, it makes sense, right?
Yeah.
Airway.
So it's not just, and it's not cosmetics. It's not just, it's function. And I think a lot of providers really trip over their own words and their own approach, because, people think to look for orthodontics after. They don't see occlusion as a disease process. We see decay, we see periodontal disease as a disease process, but a malocclusion will wear those teeth out faster. So we're not approaching it that way, I think, many of us.
Yeah, and that's part of my presentation too, and I think everybody needs to understand is that when you're treating somebody for Invisalign, most of the time, they come in because they don't like the way their smile is or their front teeth are overlapped or whatever. But, we tell them, hey, you're going to get your teeth to look better, but guess what? You're going to be healthier too.
Yeah.
The teeth are going to be biting against each other more properly, and so they're going to wear less. You're going to be able to clean them better. You're going to avoid periodontal disease down the road because you can clean your teeth better. So it doesn't matter if you're coming in for cosmetics, you're going to get health, and if you come in for health, you're going to get cosmetics. And so they get a double benefit for what they're doing.
Yeah, I love that, David. I wound up saying the same thing. We have this term in medicine and dentistry about cosmetics versus health. Looking healthy is better cosmetics. Like, you don't go to get, when people are healthy, when they exercise and they're fit, they look better. When your teeth are healthy, they look better. So it's really that conversation.
Absolutely.
They're not at ends with each other.
Form follows function.
Exactly.
Right. And Craig, I for a long time was grinding on teeth. That same case you showed, hey, let's do it in veneers. But I don't cost myself, or I lose veneer cases all the time because they come in for them, and I talk to them about, your teeth are gorgeous individually. They're like these beautiful pieces of furniture, and all we have to do is move them around and put them in the right order, and all of a sudden you're going to have like a home and garden smile here. So
and they don't see it, by the way. Like, especially when you have a diastema case, they think their teeth are skinny. They're not. It's just there's too much space. So to close those spaces, it looks like you've done something magical to them.
Yeah,
I love
and
that
again,
analogy you just gave. I want to pause on that because I think that's something that, we talk about communication and such being so vital in dentistry, David, and something that's kind of missing in terms of enrollment and getting people being able to deliver proper treatment. But even saying to someone, hey, I love your teeth, and having them come in for a consult and be like, what? They're just, it's beautiful furniture, just in the wrong place in the room. Like right there, I'd be like, you complimented me and gave me a solution. Right? Yeah. I'm in. So
it's one of my favorites.
I'm going to have, I'm writing that down. That's great. That's a great metaphor, a great analogy, and it makes people feel good.
And it's a good feeling too, to help people. They came in, okay, hey, I was going to spend $10,000, $15,000, and it's only going to be $5,000.
Right.
I mean, that is,
and I get to keep my teeth.
Yeah.
Remember that 15 grand is just for the first set. Even the best guys in the world, the veneers are going to fail. So what does the set number 2 and set number 3 look like for that 25-year-old girl?
So what ends up is we're doing the right thing because we have the right tools. Instead of having just a hammer, we have, I don't know,
screwdriver.
Screwdriver.
Yeah, a blowtorch.
Yeah.
David, I want to know from you, as someone who's, obviously we know your whole background, and I'm going to hold up a piece of paper that's blank. On the other side is my answer to the question I'm about to ask you.
Okay, good one.
So what's the piece of equipment that you couldn't live without and has the highest ROI?
My camera.
Well, you guys can't read my writing. Digital camera. That's something I want to stress, and I want the takeaway to those of us who are listening who may not do that with full conviction. Pictures sell dentistry. And I can't tell you how many offices that I've seen that don't have either proper documentation or big enough screens to talk about the teeth, or their pictures are horrible. But pictures sell and enroll dentistry. And I use the term sell. I'm probably going to get some arrows and hate mail for this. It's not selling, it's educating, but whatever. Everything is sales. And so you're trying to sell someone to getting the ideal treatment, just like you were, David. Your treatment is good. You're trying to go conservatively, but if you can't talk them through that and show them and illustrate the furniture in the room and the big pictures, they don't have pictures. It's impossible. So anyway, I know I'm stating the obvious to you guys who are veterans, and you totally see the value in your digital cameras, but I visit lots of offices and see lots of instances where I'm like, wait a second, what pictures are going on? No, we don't need pictures. We can enroll just fine without that.
Yeah.
Interesting.
And what a lot of the guys at AACD did, and a lot of the people that I talked to about Invisalign go, yeah, I take pictures. Yeah, after they say yes. But, it's like you're missing out. There's a lot of people that would have said yes if you would have showed them the pictures before you presented the thoughts and the solution.
It's amazing. People don't have a good grasp of what their smile looks like. They really don't understand.
No.
I mean, every time we show the pictures before pictures to a patient, it's like, wait, whose teeth are those?
Yeah. Don't you love that?
Or one thing I always do is every Invisalign visit that I have, after let's say 2 or 3 months where there's recurring visits for those patients, and most importantly, the very last visit that I have with a patient, I always put their before picture up on the screen, because oftentimes they're coming in with a small complaint. Like everything's great, don't get me wrong, but like this area. And then they walk in the room like, wait, who is that? I'm like, oh, that was you 8 months ago. Like, no, it can't be. I'm like, oh yeah, you're right. That's Joanne. Oh wait, you're Joanne. So, but it's amazing
Exactly.
how they forget.
They really do. And it's like you're talking to a 40-year-old and you're telling them something new about themselves.
Right.
I mean, that's pretty amazing. We can tell something new about somebody when they're 40 years old. Show them something new. So
It's true.
But anyways, it's a great thing, and want the dentists out there to think about incorporating it. But you guys talk about this all the time, and that you have to take a leap. You can't just like drip your toe into it, because if you try to do that with Invisalign, you're going to be sitting there delivering trays to a patient for a half hour, and you're going to go, this isn't worth it.
Right.
So you got to really kind of jump into it where you're doing at least one case a week, so that you can train somebody that's going to deliver the trays, that's going to explain what to do with the trays and all that kind of thing. And the only time the dentist would come in would be to place the attachments, take them off, or troubleshoot a problem, or celebrate the smile at the end of treatment.
Right.
So that's where I think dentists get thrown off, is what Pete said, camera. And the other is, hey, well, I tried it, but it didn't work. And it's because you didn't delegate. You guys talk about this all the time, and we're the leaders. We need to delegate to our team, and the team can really take the ball. And that's what happened to me in my practice, is that I had this one assistant that just loved Invisalign, and it was right after I laid off my associate, and she took the ball for Invisalign and then started doing the things for me, arranging the pictures, entering the treatment on the Invisalign site, doing the appointments, making sure the trays were pulled and the buttons were loaded. And she started doing that for me, and it made it easy for me. And that's what I think dentists out there need to understand, is that take a big leap. Don't just try it.
Yeah, you can't dabble, right? It's like a jack of, everyone, we get into the jack of all trades, kind of master of none. Like, don't, pick a lane and kick ass in it, David, what are some of your biggest mistakes in your career?
I made a lot of them.
What's a biggest?
Well,
some of them, yeah.
When I first got out of school, I worked as a couple of associates in associate offices, and I wanted to get out of those associateships. And so I jumped in and bought into a partnership. And I didn't really understand the situation with the partnership. There was 3 other partners, and they were doing capitation dentistry.
Oh, shit.
And I didn't understand the treadmill you'd have to get on to do that. And after about 8 or 9 months, I needed to get out, and I did. And I was kind of angry, and I probably pissed them off a bit when I left. And so we ended up in a lawsuit. And the probably 2 biggest mistakes was leaving angry and then getting into that practice without really knowing what I was getting into.
Mm-hmm.
And ever since then, I really appreciate private practice dentistry. And I really appreciate, the value that we can provide to patients and how we can make them happy, as long as we have the time to treat them properly, to listen to them, to communicate, and then do the work right. And so that was my biggest lesson, Pete. I haven't shared that with anybody for a long time.
Well, I mean, that, the silver lining there, I always try and look for that silver lining, is obviously it pushed you to a place that you wanted to be so far away from it that it drove you to your passion, which is the boutique, in my lane, master of cosmetics, master of Invisalign. It drove you it drove you there. So, I mean, I think that's, everything happens for a reason, right? And so that was more than likely it's reason for you. And look at the lives you're impacting. What's your best, what would be your best you're obviously a very fluent marketer, I'll just say, I can tell. And you've seen all the trends, and, you've had a long career. You've seen all the trends, and we talk about kind of on the podcast, like I used to tell people how you could almost hack your way to number one just by, buying a bunch of links and doing shady shit. Not shady, but you know what I'm saying? So what would be current day 2018? What do you think what would be your best marketing hack that you could tell people that really works? And it doesn't have to be amazing. If it's a simple answer, I'm not trying to cut you off there, but I know I just built that up as being like this, dun, dun, dun.
No, I really think, if you want to be kind of in private practice and higher end, I don't mean that in a bad way or whatever, but you have to have a good website.
Mm-hmm. Okay.
And it doesn't have, I used to have that image kind of website and glamorous kind, and I got away from that. It really has to serve what the patient's looking for. So you go to the website, they look what services they want, they click it. And then the other thing that has been really important to me, both with my Invisalign website and my main office, my cosmetic dentistry main office website, is having a contact form that has request a free estimate. Because that request a free estimate gets them one step further down that funnel to where they tell you what their problem is.
It's a buying question.
You can respond to them, and you have a reason to get back to them, and they have a reason to get back to you to hear the answer. And so both my Invisalign website and my other regular website has a contact form on every page, and then there's a request a free estimate about their problem.
That's a great tip, because it immediately puts people into, I'm kicking tires and just in my due diligence finding out information versus I'm kind of ready to buy.
Yeah.
Right? Because asking for an estimate is a buying question. I know I'm, again, stating the obvious for you guys, but man, okay, so David, I don't have it. I keep calling you David. I know it's Dave.
No, whatever.
Either one? All right, that's good. People always say that to me. Hey, Peter. I'm like, I don't really care. Regardless, what I want to go is there anywhere people can connect with you? Obviously, I want you to tell your website for your practice so people are curious, they can check you out. But an email, I want people to be able to, if they have further follow-up questions, just to continue the dialogue.
Yeah, no, my email is it's not Dre, but it's Dr.E.
Can you make that as an alias, please? I
guess I will now. That's
Dre shop of Invisalign.
Yeah, it's Dr.E at eshomdds.com.
Okay.
And if they want to hear more about, Invisalign, I'm happy to talk to them. Again, I think it's the best service we do for people. I mean, I'm prejudiced, but it really is the best service for most people. Once they're healthy, it's the next level of health. And they want to know more about that. Do you think
this is the best time to be practicing dentistry or not?
I really enjoy what I do, so I'm very, very happy, but it's competitive. And I feel for the recent grads, and I've taken some time to reach out to recent grads and help them. And then I have one that just graduated that she's working with me now, and she's doing great. And I'm trying to teach you to do what
you'd be the good mentor type, and I mean that with all sincerity and a compliment. You can just tell you obviously have a wealth of knowledge, and you'd be a good trainer. So anyway, I don't know. That's just what I was thinking. It came to the tip of my tongue. I wanted to say it. Craig, anything else?
I have a couple of questions real quick. Just, a lot of what you said is, there's some similarities between what you do and I do. So it's no wonder that we're getting similar results, although congratulations, you're at a higher level than I am, which is awesome. But I am delegating, and the people that are doing a lot of the tasks are really enjoying it. They report higher levels of satisfaction with their job. They really like it. not every assistant just wants to be just suck spit and play a secondary role. They like to be active.
Right.
Couple things though. In that, it seemed as though your middle of the road fee was about $4,500. Are you bundling the retainers in with that, or do you find that in order to stay competitive, you're just quoting the fee just for the Invisalign?
To be honest with you, I quote the fee just for the Invisalign.
Yeah,
Because
as do I.
what everybody else around me is doing. I've had this bidding war with a few of my competitors here. I don't know if you want to hear about it or if we have time for it. But, my original concept of being low cost Invisalign was $1,000 off normal Invisalign fees.
So what was that? What fee was that?
Pardon me? Well, see, that's just it. You don't have a fee. It's whatever level they were, because based on their level of difficulty, we take $1,000 off. And then when people asked us about the 1,000, and maybe some people might think this is not direct, but I say it's about $1,000 off what an orthodontist would charge you down the street. And we know what the orthodontist fees, but it was actually more than that. It was a lot more off than that. And so then a competitor went to $1,200, and so I matched them at $1,200 on my pay-per-click, campaigns. And then they went to $1,500, and so I matched them, and I'm going, God, what are you doing here, And so now in my area, it's $2,500 off, just because that's where everybody went. But if you go to the orthodontist office, it's like $7,500. At our office, it's less than $5,000. So it's not really a lie, but I'm not bound like these other people are to UCR, and you're in network, and this is your fee, and you got to be this much off it. And so it's just a little bit of a game. But we say, hey, our lowest cost fee is $29.90, but we need to see you to see the level of difficulty, and from there it can go up.
And with your level that you're at Diamond Plus, correct?
Correct.
So you're paying less than everybody. So no one's going to really beat you. You pay less than everybody, don't you?
I'm the number one in San Diego. I don't know. I'm sure there's other people that get close to me with that.
Yeah.
But that's another thing too that needs to be pointed out is that sure, when you do more cases, I get about $700-800 off what a normal fee is on Invisalign. But those Invisalign patients that are coming to us, they also have about $1,400 worth of general dentistry treatment to do.
Yeah.
And then they also become a lot of them can become a lifetime member of our practice. And so there's double
orthodontist has to monetize the entire relationship in the 1 year that they're treating them. We can have a patient that comes in, says, I need Invisalign, but they have 4 broken teeth. So before you even do the Invisalign, you have to fix those teeth, and and they trust you and like you, and then they become a long-term patient of practice. So it's more adept from a business standpoint for a GP to be doing Invisalign than the orthodontist from a business standpoint. But
Absolutely.
you do have to get your training, and you have to learn what you're doing. I always say that you start off in dentistry with an empty bag of experience and a full bag of luck. And the goal is to fill the bag of experience before the bag of luck runs out. It's the same thing a pilot, actually. Pete, you'd appreciate this. Pete's dad's a pilot, and I'm a pilot as well. But that was something that was told to me by a pilot. Like, you'll start off with an empty bag of experience and a full bag of luck. And it's true. But, whereas when you prep teeth, you're committed. You're pot committed to that whole case. When you're doing Invisalign, you move the teeth, you can move them back. Not to say that it's without risk, but it's something that I wish more providers were doing. And it's a wonderful service for the patient, even if your goal is not to do what David and I are doing as a tool for pre-prosthetic stuff. If you have teeth there's improper space, you can do a quick case and get the teeth in the right order for pre-prosthetics. One other question I have, what about financing? Are you doing much financing?
I kind of take a opposite approach to financing, in my office. In that, when I get to the fee and it's $4,500, so let's say it's $4,500, I say, hi, Norma, the fee for your treatment is $4,500 today. And I know you, let's see, how's it go? So I know that you wanted us to tell you the lowest fee that we have. Because if I were somebody going somewhere, I'd want to know what the lowest fee is. Well, our lowest fee is $4,500, but that's for payment in advance. Mm-hmm. If you'd like to do financing, we certainly offer that. We have some in-office short-term for 3 months, or we have some outside financing. But with those, there's administrative fees. Right. And so the patient gets to choose. And then that way I get to finish the case when I want to finish the case, not because I haven't got paid yet, like a lot of orthodontists do. You know, all their cases are a year or 2 years because that's how long it took for the patient to pay. And so this way I get my money up front if that's what they want to take advantage of, or they can pay over time, but I'm quoting them the lowest fee.
Yeah, so I take an opposite approach. I tell them a monthly fee. We don't present it as $4,500 or $4,800. We say it's $200 a month for 24 months interest-free financing. I'm using Care Credit, but Care Credit's taking like, what do they take, Pete? Probably like 5% on an orthodontic case, I think, 6%. I'm not quite sure.
I thought it was their standard 10%, but
Yeah, me too.
I don't know.
I'm not
no,
sure.
on orthodontics, Care Credit's less.
Okay.
I'll have to check that out.
But still, you know,
but yeah,
I think
it's really hard for me to be low fee and then have to take another 10% off. And so we approach it that way. My Invisalign rep, of course, have talked to me about, you know, financing, but it's kind of like hard because you have to commit yourself one way and go through it that way because you can't switch the fee just because it's going to cost you more to finance them.
Right.
But either one works. But that one's my go-to with it. I want to ask you guys a question. Okay, so Pete, how do you manage 4 offices? And Craig, how do you manage, what is it, 50, 60 employees you have? I mean,
yeah, 40 something.
What is your time? I think, Pete, you're clinically 10 hours. And Craig, what is your clinical time and your admin time?
I've just recently gone from 3 to 2 days a week clinical, but my 2 days a week, I consolidated the 3 days. I just do Invisalign, so it's 3 columns deep, just moving all day long.
I see.
Yeah, he doesn't come up for air, so it's really like it's the equivalent of a 4-day week. You just kind of triple and quadruple booked in those columns. But back to your question, how do we do it in our respective way?
Pete has it easier.
Why do I have it easier?
I'm just joking with you. I'm just joking.
You know, honestly, I'm gonna say, Dave, that I have a good team, and I know I am very vocal about my highest and best use for my practice, and then I'm very able to say, God, I suck at this part of the practice, or I don't enjoy it, kind of like what you were saying. So let me employ and find the person that loves it and complements that. So I have amazing docs. I have an amazing team. I have an amazing executive assistant. Like I just have a lot of people that kind of that help support that, and it allows me to kind of be the dreamer and the crazy idea guy, and the marketing this and that. But it's like you, I'm having a whole lot of fun, which to someone else that may seem like 4 practices seems like a horrible time. Like I could never imagine that. That sounds like, that sounds terrible.
Yeah.
But I really love it. I love growing the team and growing the vision and really leading people. I really like to do. So I didn't answer your question how, other than just it's the team. And the minute I got out of the way of myself and said, you know what, I am not always the best person for the job, which I had this arrogance when I was in my 20s and probably 30s, that saying that, like if there's someone who can do it, I can do it, right? If you want it done, give it to a busy person. And that was me. I'll do more.
Yeah.
And finally, I just kind of came to the revelation that, like, golly, I'm really not as good as anyway. So that was a long-winded way of just saying, surrounding yourself by an awesome team and spending the time investing in them, whether it's time, training, or otherwise, and as much as you can, running a busy life.
And I appreciate you guys turning me on to Chuck, is it Blakeman's book?
Mm-hmm.
Yeah.
I've listened to it, and then now I'm reading it, and so appreciate that. And I think
he's a master. He's awesome.
He's got
Craig,
some
what would be your
stuff.
answer?
Well, first of all, I think running 4 offices is not for everyone. You've got to, I think in dentistry we're all
Says
guilty.
the guy who has one.
Well, no, I think that we're guilty. In
Craig, I'm just kidding you. It's part of the show where we bust on each other.
No, I know. I'm not willing to retaliate. I'll get you back later.
All right, fair, touche.
Yeah, I think that in dentistry we're guilty of this one size fits all philosophy of like, what should I do? Like, oh, I met this guy and he had 6 offices and he seems like that's the way to go, or I have this boutique thing, and it's really like you pointed out, Dave, you understood what you wanted because you got a clear understanding of what you didn't want. So you had this failed partnership and a really busy capitation office. And you're like, oh, damn, I definitely don't want that. And I think a lot of doctors are, with knee-jerk reactions, are saying, let me open up my second and third office. And they don't really have the entrepreneurial drive and the vision that a guy like Pete has. They're just doing it because it's like, well, I have one over here, and I heard there's a developing community.
I call this, Craig, too. Sorry to interject, but it's like a cut and paste goals and dream, right?
Yeah.
Like you really don't have one per se, but like the guy that just said that sounds pretty cool. And, you know, he just sold, and that's what I should do. So you cut and paste someone else's dream and vision into your life, and it may not coincide.
Well, we do it all over our lives. You know, you have a buddy who has a really cool wife that makes dinner every night. You're like, oh, my wife sucks. You know, here's my wife makes dinner. Or like my husband doesn't do that. And like we cut and paste, we cut and paste everything in our lives. And there's not a whole lot of intentionality into our vision. And Pete and I just got through writing a 3-year vision. I did one and Pete did one. Like we're going to wind up December 31st, 2021.
Nice.
It's intentional. And I'd challenge everybody to do that, because you have to have something compelling you. Elon Musk had a very compelling vision. It wasn't like, oh, you know, Chevy built the Volt, I guess I should build a freaking Tesla. Like these guys, and then when you're driven towards that vision, it's not work. So like what you're doing, most dentists would look at what you're doing, Dave, and say, holy shit, I could never do that. And I mean, I know business well enough to say you're probably making more money than Pete or I, because like with that type of,
about that.
Well, I mean, look, you can, depending on that over, well, let me say not more than, well, I don't know what you're doing and what anyone's doing, but when you have a single office that's redlining in production, like Revin at all of its maximum usage, and you're delegating a lot and you're happy, that's the perfect fit for you. I had a buddy of mine call me like, hey man, I want to do what you're doing. I'm like, okay, why? Well, you know, blah, 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 blah. I'm like, really? That's the reason why? I'm like, what's the real why? And he didn't have one. I'm like, bro, just stay where you are. You're kicking ass. You get home by 2 o'clock every day. You make all this money. Like what, you got to have something that compels you beyond just making money. People need to make meaning and not just money. So when you say what did it for Pete, Pete is constantly looking for ideas. The guy's texting me at 11 o'clock on a Saturday about some crazy, he's just driven by it. If you gave Pete a fat check and gave him $20-30 million, he'd sip champagne for a month. But in the 5th week of him being off, he'd be toiling about something new. And I'm the same way too. So it's like my vision had me do that. And it's not like we learned how to do it because that was we weren't in the tyranny of how to do it. We had to do it because the why was so big, it required us to have so much infrastructure. So my why supported 40 people. Pete's why supported 4 offices. And Pete, I know him really well. The guy's not stopping, but his why is different. It's not being done. He has a hunger. So
nice. I love listening to you guys and seeing your thoughts, because you're right. It isn't just because of bigger is better. It's because that's what you guys enjoy, and I enjoy watching and listening to you guys talk about that more than everything else.
I think too, Dave, Craig, that was kind of pretty beautiful what you said there. So I'm not going to dilute it with what I was saying, but you know, something that's dawned on me a lot and is, you know, we get one ticket in this life, and I want to be able to look back and be proud and feel fulfilled in what I did on all aspects. And that's why Craig and I are, you know, we kind of share a business coaching, are super intentional with all aspects of our life, not because we have it perfect, but because we want to bring awareness. And because like without awareness, how do you know? And so, you know, to me, I just want to look back when I'm 60, 70, 80, God bless that I make it that far, or God willing, and say like, you know what, like I gave it 100%. I kicked ass. I tried to do the right thing all the time. And I fulfilled my bucket of my why and I fulfilled all those things. And I don't want to say like, dang it, like having regrets would be the worst thing. So
right,
that's
sorry, Pete, but I just want to caution what you're saying, because, you know, Gary Vee and all these people that will say like hustle, you know, work, you got to work while your competitors are sleeping. I think that we have a sickness. I always talk about this. We have a sickness in American culture of more, bigger, better. And I want
that's
people.
Not what I was saying, but
no, I know you're not. But I just don't want people to hear that. He's not saying that. Like I know Pete well enough, but I don't want that to land on people like, oh, you know, I got to have 4 offices. I got to do what David Eshom's doing, or, you know, what Craig's doing. It's really about, like, you know, one of my doctors that left recently, Evan, he went to Austin, and he told me, he's like, you know, man, I've had a great ride with you here, and blah, blah, blah. And he was wearing sunglasses, and I could tell he was getting a little choked up. He's like, look, I want to move to Austin, and, you know, I want to figure out more time to read and more time to blah, blah, blah. And I was like, that's really cool, because kicking ass in life is personal. Kicking ass in life may be being able to get home every day at 2 o'clock and be with your kids.
For sure.
And another person may be home with their kids at 2 o'clock, and your son may be learned from you that work is not important. He may grow up on the couch smoking weed. So it's like, you never know what you're going to do. You just,
but that still goes back to, you can still interpret that, like I said, Greg, the no regrets. Like, if that's what you want and you feel fulfilled by it, then awesome. Like, live that and position your life so you get more of that. And so
yeah.
I
Well,
totally
life
agree
by
with you.
design.
But I'm glad you clarified that, because I wouldn't want everyone to think that's what I was saying.
Well, that's awesome. You guys are expanding dentist mind, so keep it up.
Man, it's a cool place to be. And it's just, you know, dentistry is awesome. It's been good to us, and dentists are just a bunch of awesome people, honestly. Like, you know, they're just good people. I can't say that about every group of professions, but usually every dentist I meet, they're just good, solid humans.
Yeah. Well, look, we cultivate long-term relationships, and we value certain things that are, you know, most businesses are transactional. You do a deal with them once. And in dentistry, as long as you're doing the right thing, you get to know people a long time. It's really cool. We develop long-term relationships. It's beautiful.
Well, David, I enjoyed it.
Well,
I hope our paths cross in person. You can try to make it out to our summit if you
Yeah, no, I wanted to go to that, but I have son's 21st birthday that week, and can't miss that. But the next one I'll be at. And
hey, David, I'm going to be in San Diego a week from this Thursday all the way through Sunday. I'm staying in Solana Beach. So let's email each other. I want to stop by and say hi. If you're not far from there.
I'm sorry I'm going on vacation till the 28th, but if you still want to come by, I'll just let you talk with my ladies here, and you can.
Any chance you could move your flights around, though?
Like Craig Spodak flying in town. Can't you move?
Come on, Pete.
Back for the day.
No, I'm totally kidding you, bro. Well, enjoy your vacation.
No, sorry, I'm going to miss you.
Well, hopefully we connect in person one day. You're one of the good guys, I can tell. And so I appreciate you spending time with us tonight, pal.
Happy to. Can't wait to meet you guys in person.
All right, guys.
Have a good one.
Good night.
Bye.